Welcome to the Common Cool podcast,
where we discuss the power of addiction,
the art of suffering,
and the joy of freedom.
Hello, welcome to the Common Cool podcast. My name is Miguel.
And I'm Jeff.
And we have our guest, Justin Baker. So I will introduce Justin and then we'll get going. So Justin is assistant professor of psychiatry at Harvard Medical School. He is also a scientific director for the Institute for Technology and Psychiatry at McLean Hospital. And he is also the director of functional neuroimaging and bioinformatics, the schizophrenia and bipolar disorder research program at McLean Hospital as well. Thank you for being here, Justin. Very, very, very much appreciated your visit here.
Glad to be with you guys.
Yeah, so I think we'll just get warmed up with the first question and then we'll get the conversation going. So, from your perspective, from a psychiatry and neuroscience, in fact, before we even go there, tell us a little bit about your background. Just what do you do? How do you get into what you do, your passions, et cetera? Let's start there.
Great. Yeah, so I'm a psychiatrist, research psychiatrist at McLean Hospital. I do have a background in neuroscience, so I did a PhD studying animals, monkeys, performing behaviors that we would teach them, simple video games, and studying their brains. I got into psychiatry because I thought it would be, really understand the circuits of the brain could be a way that we would improve how we treat people with mental health issues. Honestly, I always expected to go back into the lab and maybe study animals, but the more I got interested in seeing mental health work in practice, I got really intrigued by just how to bring more of a scientific approach to how we treat and understand people with these conditions. So I have stayed involved in, I did a residency in psychiatry. So I did, 4+ years of working directly with patients. And then since then have run a research laboratory where we have applied things from neuroimaging, putting people in MRI scanners all the way to really understanding how people speak with each other. So using like linguistics and analysis of people's nonverbal behaviors to understand people's mental conditions. So that's kind of my academic background. I'm originally from Georgia, Atlanta, Georgia, and grew up between Boston and where I am now and Georgia. So awesome. Yeah. Thanks for being here. Yeah, I'm super excited to hear some of this stuff. Yeah. I'm really big into the, how the brain works, and especially with mental health. My background is in both mental health and addiction. I've worked all the way up from like working in an acute psych unit, case man in Chicago, like running around trying to find people and get them their meds and get them their money. So I've seen a lot of like severe and persistent mental health issues, and with the addiction, piece of it in that for like the greater part of like the last 10 years. So, I've done a little dabbling, but I'm super excited to, pick your brain. That's what
That's good.
Yeah. So, when it comes to addiction, like how do you, can you explain the neurological explanation of addiction for us? Sure. So I like to teach, I teach the psychiatry residents when they're almost graduating, and they don't hear a lot about the brain, honestly, during their training. It's not something that is relevant in the day-to-day practice at this point, but I feel like it's important to at least give them a feel for what is the brain there for, right? What is it doing? Why do the conditions we see and experience, why do those occur, right? And so in the context of like normal, healthy, adaptive brain function, you need to develop habits as a way of simplifying how much energy you spend on regular routine behaviors, right? So as you're growing up as a baby, you're quickly learning the patterns of movements that get you the rewards that you need to survive, right? You need warmth, you need metabolic things. So you learn to just do that. And you learn to do it with so much precision. You become like a virtuoso of that thing and that basically means you're spending less and less energy on it. And you're able to achieve the same goal, right? So you're initially fumbling around, and then you eventually focus in on that behavior to where you're really achieving it with this precision. So when I think about people developing habits as they get older, you have, when you're a little baby, you have to develop these habits, but then you basically figure out how to optimize within the context of having parents and so on, like a nest that's taken care of for you, right? But then as you move into adolescence, you now have to shift your survival goals from you're being taken care of until now you're actually having to establish your own nests, your own survival goals. And so in that context, you have to switch up all of your assumptions about what you learned as a baby, and you have to learn a bunch of new ones. So you have to go into a risk-taking mode to basically learn whatever life is telling you is some optimal way to do those movements, patterns, right? To get the optimal reward. But the brain doesn't know what is optimal. It's when it's a baby, sure, like warmth and nutrition are the things. But as you get older, actually optimizing for a world where you have to have social relationships and you have to have, all of those, you have to be able to establish your own new nest, et cetera. You go into an adaptive risk-taking mode. And so in that context, you are going to learn new habits that solve for that in an almost random walk kind of way, right? You're going to latch onto something. If it's smoking cigarettes, because that's the way that you were able to have some social interactions that felt adaptive, then like the cigarettes are going to get built into that routine, right? You're going to chunk that together as a sequence of behaviors that led to the optimal reward, right? And so as people are thinking about, the brain and how it's, the neurological theory of addiction, it's really about, I think it's more about learning, like the optimal learning and all the circuits that do learning in the brain. And then of course you have the added element, which is that a lot of the addictive substances that we see really push on certain neurotransmitter systems in the brain, right? So if you think about alcohol and, like sedatives, basically, those are pushing on the brake pedal of the brain. So if someone is like, as they try to navigate this new setting where they're having to like find these new optimal associations, if they're too ramped up, they're too anxious, right? They need to be optimal. They have to actually ramp themselves down, right? Because you can think of like this inverted U of optimality, where if you're too high or too low, you're not learning you're not performing in the way you need. So you have this system, which is basically the norepinephrine dopamine system, the catecholamine system, which if it's either too low or too high, the prefrontal cortex can't do its optimal stuff. So you want to find ways to get yourself into the middle of that. And so if you're the kind of person who's too high, you use things like alcohol and GABA drugs, drugs that push on the GABA system to pull yourself down. If you're too low, you do stimulants and other things that pull you up to your optimal. And that people find these drugs and they allow them to get to their optimal place in ways that are pharmacologically enhanced. But, the fact that people would then be addicted or habitualized to those substances as part of this routine that they find, in their random walk is not surprising. It's then just a question of like, once they've gotten there, do they still need the substance? How do you then unwind all the components of a habit? If you think about any habit you have, it's got all these components to it. How do you know that this one step, right? Step 10 is like not necessary. You could pull it out and still be able to perform the behavior as needed. So that's just not the way the habit system works. It's all about chunking these behaviors together. And then it's very hard once they've been chunked together to take anyone out of the system. So does that kind of make sense?
Yeah, things make good. It sounds like we go through a stage where we're finding these adaptive behaviors that allow us to develop properly, I guess, right? And continue with life. And there's a stage in which we start taking more risks, because we're trying to find those things. So we're in this discovery phase, and that's normal. But then somewhere along the road, we encounter substances, right, that start putting us into balance. If we're too high, alcohol will chill us out. If we're too chill, maybe we don't feel like we function well being too chill. So we need some uppers to bring us in the middle. And then because we like to be in that middle that we're not in naturally, then we develop the habit of consuming these enhancing substances. Does that more or less summarize it? And then, so related to that, then, so I think some of us, and myself included, in that group, some of us may end up abusing them. And now if you abuse them, it feels like now you're creating a new problem, which is a new imbalance, right? So tell us a little bit about that. Like, if I think that's going to exhaust my dopamine, well, now I'm creating a different problem. Now I can't get to my natural balance easily. Like if I push my dopamine, 1000x with amphetamines, now getting back to my balance level is going to be too hard because the pendulum will swing to the other side.
Right. I mean, you brought up a lot of stuff. So, I mean, I guess this line between use and abuse, right? When does using the substance become abuse as opposed to just I'm tweaking myself into my optimal place? So there's obviously this situation where dose matters, right? So like if you're taking, let's say, cocaine, right? It's like, you take one line of cocaine and you get into your optimal. Taking 10 lines of cocaine, you're probably not optimal anymore because you've now gone way over here, right? And so at a low level, the brain is saying more cocaine is good. It's like just doing that is a good thing. It's worked for us in the past. But so you can get into situations where part of your brain is telling you just like do another line, but the reality is you've gone way past your optimal and you do it anyway. Right. And this is where, every potential behavior is going to have the behavior that gets expressed and then the behavior that's sort of latent and doesn't necessarily get expressed. And so a lot of what you have to be able to work with is like from a top-down way, being able to superimpose like at any given moment, I'm going to have a lot of behaviors that I'm being told to do. And you have to weigh the ones that are actually good idea and the ones that are going to get you into trouble. And so like, just because eating that piece of fast food or like having that hit or whatever was helpful to get me into my optimal does not mean I keep using it. It's like, it's just like 10 times a dose I could overdose. So it's about like learning your own, like why you needed it and learning to hold yourself accountable in a more micro way and not just being kind of, it's just like impulsivity and being able to like work with that prepotent impulse. So I don't know if that's making sense, but it's like, it's almost a philosophical issue, what's abuse versus use, but it's any use that's going to cause downstream problems is abuse. You want to be able to have use that's consistent with your overall survival goals, but doesn't interfere, and I think that's the slippery slope of a lot of addictive substances. That it's very hard to then, it messes with your ability to make judgments, and then you end up making impulsive behaviors because that's what the substance helped you to do, right? So, as opposed to, you're exercising or you're doing other behaviors that are more, let's say naturalistic behaviors where you're going to have other consequences if you over-exercise. You might be sore, you might have but it's problem with substances is there are some substances where there's not a lot of near-term consequences to overuse, or that people ignore them, so having hangovers, like, when you're younger, you might not even experience much of a hangover. Or if you do, you don't remember, you don't link it to the behavior you did the night before because your brain is not doing that kind of time travel, right? As you get older, your higher order association systems like the prefrontal cortex are able to do that time travel. So they're able to at least link behavior I'm doing today with, consequences that happen today with behavior I did last night or a week ago. So, this gets into the whole sort of, when you're in that adolescent phase and risking more, part of what's happening is you're putting on hold that future consequence because you actually need to. It's adaptive to begin trying out new things despite the consequences. As you get older, you need to be able to zero in on consequences.
Okay. Yeah, that's a reason why most people end up getting sober is because of they keep building up more and more consequences based on their actions, and then, decide to make a change because there's no like pleasure. Most addicts, the pleasure's gone a long time ago. It's just reducing pain, really, for the most part. And then dealing with them. About what age do you transition to this like more high risk taking approach to life? To kind of start setting new habits.
Well, right. So biologically, that's what puberty is, right? It's trying to shift your focus from the nest that you've been given to creating your own nest. That's like what all the hormones are there to help you to do, and to basically steel yourself across that transition, right? Whether it's like all the emotionality, all the kind of, going dark or whatever, those things are there to help the brain make the transition into a new set of assumptions where you have to then, make your own nest, take your own risks, find a mate, etc. So, now in practice, we don't really do that until we're like out of college. Going to college is a big step, right? Because you're leaving your home, that you're physically leaving in many cases. But you're still somewhat protected, right? By institutional. But as you graduate college or whatever your sort of schooling is, then you are truly left out in the world to fend for yourself. And I think that's the riskiest point, because depending on when you make that transition, often your prefrontal cortex, et cetera, hasn't fully developed yet. So you're both having to like learn all that stuff while you're still very driven by your basal ganglia, your striatum, these parts of the brain that are there for that habit circuitry, and they are really optimized for finding the best solution, basically.
Yeah. I do remember like one of the most stressful times of my life was my junior year of college. And I don't know what it was that was going on inside me, but I just remember that I started having panic attacks. I started to feel like intense, like insecurity. And that was the first time in my life that I had actually, I walked to the store and bought some liquor or bought some beers to use in kind of a, medicinal sense. Like that was, I do remember that time because and that must explain it. My mind was probably like looking out in the future and realizing that maybe I wasn't set up for it.
Right. Or, you were shifting yourself, your anxiety is about the future where we're basically putting your whole brain into this like fight or flight mode where you're just like constantly feeling like, I'm not okay right now. I need to do something. I need to like act, but like, what do I do? You don't know what to do. And so there's this like intense energy that's just boiling around right inside of your body without a clear place to resolve itself. And so you have two options, right? You have to do a behavior that's going to cause that energy to get dispelled, like dispersed, right? Or you find a drug that will pull you down, right? It's something that you can just take, and it's basically like turning the gain down on the radio. So, I do think that, as you move into that stage, part of what your hormones are doing is it's like filling you with all this, like potential energy, right? But what do you do with that energy? It's like you're just having impulses to do things you don't fully understand. And so that's where I really do think that ends up basically moving around your nervous system. And unless you have a clear behavior that you can put it into, it's going to bounce around, right? And where's it going to go? It's going to go to like movements. You might be restless. It's going to be these racing thoughts, things that you can't get out of your head. The content of it almost doesn't matter, but it's like that energy has to go somewhere. And so that's where habits and things like that are a really nice place for things to go, because it's like when you need to get rid of a little energy, what do? You just like pull out the cigarette. You just like move through that set of behaviors. You go through whatever those action plans are, and it like just disperses a little bit of your energy. And so you find things like that like are whether, again, some of these are productive behaviors, right? Like meditation, yoga, etc., like physical running, like those are also things you can do that will get rid of that energy that's just bouncing around. But in many cases, people don't necessarily find those. First, they find assumptions they want to do, or just, just some set of actions that they can go through that will get them to feel like this energy is going somewhere.
For sure. Yeah, I had plenty of energy.
So since we're talking about habits, I figured just bring up real quick this diagram from your deck that you shared with us. Sort of like illustrates the neural circuits that have to do with habit learning that we're talking about. So maybe you can dissect a little bit for people to understand.
Right. So I think it's good to think, if you have ever heard about this area in the brain called the basal ganglia, it's sometimes also called striatum. Forget the names. But it's part of that more core part of the brain that's there to help you learn habits, basically. And it's important to remember that these habits can be movement habits, like learning how to brush your teeth, or learning how to eat food, or learning whatever, shoot a basketball. But it also can be cognitive habits. So just the, sequences that your brain goes through that are thoughts, right? So habits of thought. And the way that all works is that these cycles between the cortex, which is the more recently evolved part of, your brain, and then it's sending information. It's basically processing all the different incoming information and feeding it into the basal ganglia. And then and then this part where it's going down to the brainstem is movements, things that can actually cause actions. But the idea is that you're learning with whatever the set of these movements that you're doing are, you're learning how to keep them optimal, and you're learning how to chunk them. And that happens with every behavior, right? Anything you can think of that you've ever learned has now been chunked into a sequence of little mini actions. And so, again, this normal everyday habit learning is all about like evaluating which of those contexts are optimal, selecting the right ones, chunking them. And then once you pull it all together, you have this habit. And most of the habits we have are really good for us, right? They help us to do all the things we need to do without having to think about them, right? Without having to spend much energy on them. If you think about things you have to do 1,000 times, it's going to be things that you want to optimize. So.
Got it. Well, thank you for taking that one for us. I think going into actually, even before going there, I wonder, so it seems like, we start with this adaptive search for risks, right? That are going to develop new habits that are beneficial to us. And that's all adaptive. And, we may take the wrong turn and we get to the maladaptive side of things. But I feel like there's two different people could go in the same journey. Like both two adolescents are in this sort of like risky stage, and they're looking for different things to do, and both end up doing the line of cocaine. Then one ends up being highly addicted and just goes off the rails, and the other one doesn't. What's going on there? Why is that different?
Yeah, that's a great question. So, obviously those two kids have had a whole lifetime of experiences before that moment. Things that happened yesterday, things that happened a week ago, things that happened in their childhood. They also, of course, have genetics that are, and they can think of this as all just like different time scales of learning, right? Because somewhere in their shared biology going back generations, that risk taking was more adaptive, right? And it was to be risk averse, right? Because it's all about balancing of that exploration with the exploitation of your current resources, at different time scales. So like if in that moment, this kid was like, I need for whatever, add up all those influences to this very moment, I need to be a little bit more risk averse right now. I didn't get as much sleep last night. Somebody said, there's all sorts of reasons why you might choose to be more risk averse. That kid's like, I'm gonna hold back, right? Whereas that other kid is in a state, again, it's gonna be added up all of these other influences. They need to be a little bit more risk taking at that moment. Neither one is making a wrong decision in that sense, right? It's like, this is just the context that they find themselves in. That same kid, next day could have been in the opposite situation, in some situations. Or like you say, there are certainly genetic influences that are going to influence, that are going to push people to take more risk taking. But it's again for a full philosophical question of like, why do you choose this versus that? I think if you're in a low mood state, you may decide that risk taking is worth doing. If you've had a lot of risk taking recently, but it hasn't panned out in your favor, you might choose to hunker down and not risk take in that moment, right? So, it's a complicated question, but it's a combination of true, like what we think of as volition, like you really make a choice and say, you know what, I'm going to go for it. Like, I don't know about you, but like I've had plenty of situations where I'm like, I probably shouldn't have that other drink, but these are people I really like being with and I'm going to do it. Right. I know I'm going to feel bad tomorrow. I have my prefrontal cortex can do a little time travel. I can say like, I'm going to feel bad tomorrow, but like, I'll take that because this is an experience I'm willing to have. Right. That's the conscious version of it. Right. But then there's, of course, usually it's unconscious, but I do think that at some level, your brain is making those kinds of choices, at any given moment. And like, if you pull back up the slide, there's that whole hierarchical decision-making slide, that I think gets at this, which is like, at any given moment, it's a hierarchical decision. Like you're kind of, if you click on number 10, that's sort of like what the brain is doing at any given moment. It's trying to figure out like, there's a lot of conflicting information for any decision, but at the end of the day, you're marching it up the chain of command. If the first level is like, oh no, this is obvious. Like, I don't like, let's just say it's not cocaine. Let's say it's like fentanyl. You're like, nope, I'm not going there. Right. I've heard bad things. I'm not taking this drug. Then you resolve it at that low level. Right. Whereas if there's a lot of pros and cons, you start to march it up the chain of command until it's up in those higher order systems that are really like, well, it could go well, it could go poorly. Let's, really compare. And so at any given moment, you're doing that. You're doing this kind of hierarchical decision making. You're weighing different alternatives. Again, not consciously usually. It's usually something that you're doing in the speed of like a few seconds, right? But
yeah, that's fascinating. The idea, because I think, I was talking to someone, I don't know, recently, and I said like, no, I've never done fentanyl, I've never done heroin. I may have smoked a little opium. I know I smoked a little opium earlier on in life, but it was just like something that I would never do. Like,
right.
I just, it would kill me. I know I'd probably like it a lot.
Yeah. Well, and if you think about like, I like thinking about cigarette smoking because it's like, it's one of those that everyone at some point in their life probably has done it, has decided to do it, right? But in many other points in your life, you would have been like, hell no, right? Because it's aversive. And so that's one of those that when you're a kid, it's staying down in those like primary areas. It's like, nope, this is an aversive stimulus. I'm not taking this. But as you get older, you're doing that time travel. You're like, well, sure, it's a little bit aversive, but also it left me talk to this girl that I like. And like, you start to do the time travel. You start to see, okay, if I do it now, it's going to have a positive, and you're able to change the value of it, right? So 1 second ago, it was an aversive stimulus. Now it's an appetitive stimulus, and you actually approach it because it's been coded as associated with the girl and future potential sex. And it's so it's like one of these where we are all dependent on our, what we've learned up till now, and also just the context that we're in. The same stimulus can get coded very differently. And like what it gets coded for a particular person, that's why you can't judge it. It's because you really have to look at whatever, you have to assume that if they're taking it willingly, like it's at this point reached a point where it's a positive experience for them overall.
So it's interesting. You said that, we go through this hierarchical decision-making process, subconsciously, right? Like we're not consciously aware of what's going to happen super, super fast. Tell me if this thinking is right. I have to imagine that what's happening there at a subconscious level is highly influenced by your belief system, your past trauma, your current life experience, and I could just keep going on and on and on. So like there's all these multiple variables that are factoring in real time, your ability to at any point in time stop or keep going or what, right? Does that seem
totally? I mean, you can think, we're in B, we're looking at the whole cerebral cortex, right? So like the whole idea is like you pack all of these experiences and memories into these billions of cells, and different sets of cells, right? The different regions can have influence, right? It's just like this kind of like government diagram on the left, right? It's like they're voting about what should happen. But like not all of them have the same access. And what's interesting is about like traumatic experiences can have an outsized influence on your behavior, but depending on where you are with your trauma, traumatic experiences can sometimes get walled off from influencing behavior, right? They can get to the point where like you can't look at it, you can't think about anything close to it. And so in a way, it doesn't have the same influence, right? So it's like that traumatic experience might be really useful to say like, yeah, actually you should avoid this guy. He's bad news. But because you walled it off, because it's like so traumatic, you can't even look at it, your memory doesn't have access to it. And so it can't influence your behavior. So people can sometimes act in ways that don't make sense, because it's not as if every point on the cortex has the same influence over your behavior. It has all to do with, how those experiences have been processed over time. And like many times people will be doing behaviors that are like patently bad for them, but they can't see that because of the way that they're, this tree that's sort of, it's like a clean hierarchy, has become kind of broken down, and certain systems don't influence in a normal, orderly way anymore.
And so then when thinking about, with everything you're saying, what I'm concluding is, some of us get into bad habits. We pick up some drug habits at some point in life, and we start even abusing it because somehow there's a reward that we're getting out of it, right? And then at some point it gets to extreme that maybe now there's no reward. Actually, we get penalized by it. So at some point we just opt out and we're like, okay, I got to change my life. That's when you kind of quote unquote reach rock bottom, right? And that's when you decide something and you change your life. Now, there's people that don't make that transition. And even if their life is just crumbling, they just continue and they can't stop, keep going. What I'm wondering from what you're saying is that to explain why the difference between the person that at some point reached rock bottom and they were able to change things and the person who just kept going and maybe to a point where they overdosed one day, the difference is really hard to explain because there's just so many variables going on in the brain of that person that didn't make it. that it's almost impossible to dissect and say, oh, well, the reason why this person didn't make it is X, Y, and Z. There's just too many variables going on in the brain. Am I concluding this more or less correctly?
Yeah. I mean, I think to the extent that there's a fine line between people who choose, let's call it choosing, one set of behaviors with what's called recovery, and the other set of behaviors that are just continue to double down on that set of habits, that can be a fine line, because again, this hierarchical system we're looking at, you can get to a point where both models of reality seem equally plausible in terms of like which one's going to pan out in the end. And you've also, in many states of like severe addiction, you've kind of like really interfered with some of these areas' ability to process information at all. So they're not contributing to the conversation in a way that's as productive anymore. But again, those higher order areas that are trying to listen to the evidence beneath them, they don't necessarily know or care, right? It's like, well, polar frontal cortex isn't making any sense anymore. Okay, I don't care. I'm just going to move to this other area, right? It's like, it doesn't necessarily know that the brain isn't working at full capacity, right? It's all has to do is to choose A or B, right? Like dark or light, like that moment, it's just choice about whether to move towards that recovery or not. And I do think that's, if you like, lower in these slides, we talk about deception. It's like, it's very easy to get to the point where you can convince yourself of anything. That's what the cortex is there for, and we do that as part of our normal adaptive function, right? We operate one way at home, one way with our colleagues, one way, with our friends. We don't have to think about it. These are just patterns that create their own decisions, create their own actions, even if those same actions would be like highly inappropriate in a different context. We have no problem doing that, right? So again, it's about like recognizing that we all have these programs in our system, pre-programmed there, and it doesn't take much to pull out the wrong set of behaviors in the wrong context, or to have like, certain parts of the brain that are not contributing to the conversation the way that you would sort of want in a different context.
For sure. Yeah. I think that's the most frustrating part about, like you had said when we were meeting before this presentation, like the frustrating part about working with addicts is like, you have to get a gauge on like when, you're always just, when working with addicts, you're always just there, like hoping that that's going to tip, like whatever that is because, from my own experience, it feels like my frontal cortex is trying to find a reason. It's like on that balance beam. It's trying to figure out like, am I gonna drink or am I not gonna drink? Am I drinking? I don't want to drink. I can say that my intentions are not to drink, but then when I go back down and start looking for why I don't like the consequences, like this, that made me feel bad. I may find a memory that has like a pleasant ending where drinking is like, and my mind will go like straight to like, of all the 100 other things that my drinking is like, let me like off the rails. Like there's this one where I was like, that felt pretty good, and like, it's just that, that emotion kind of packed memory, like where I always felt safe or secure or confident, whatever it felt,
It overwhelms the other parts.
Yes.
Absolutely.
Yeah. So kind of while we're in this space, people get frustrated with the addict, right? Like Nancy Ray, just say no,
right.
So, and this is where I get into this moral area, like, the idea of powerlessness and like you had said something about the idea of deception, like, and as an addict explaining, I think it's as an addict, it's much easier explaining because it's happening to you, but like explaining it to someone else, like someone who loves you, like I love you more than anything, but I continue to do this.
Right. Yeah. So I think this idea of the deception, I mean, I think it's like why I was always, I thought it remarkable that children naturally deceive. Like you don't have to teach children to deceive. It's just natural that when you feel that you need or want something, you naturally deceive people. Not because you disrespect them or anything like that, but because it's really, I think it's like sensory motor. You know what to say to get the outcome, to say or do to get the outcome that you want. And so when someone who loves you is like, but why did you do that when you know I don't want you to do it? Or why did you lie to me? I think it can be it doesn't make sense to the addict, because it's like, well, I didn't do it to hurt you. I just was like, this was the way to get what I needed and also have you not be upset, And so it's the brain's way of latching on to what constellation of behaviors, however seemingly arbitrary, get the outcome that works. So it's like, you think of morality as this coherent set of behaviors, the 10 commandments. So it's like, let's just do all of those things and we'll be okay. The reality is human behavior is far more complex than that. You're always balancing being perceived as moral and also having your own needs met. So you're always trying to say and do the things that you need to do to not receive some kind of negative reinforcement from these outside, and also have those needs met. And like, we are taught in our culture that a lot of the needs we need to get met are sort of taboo needs. And so that inability to talk about those needs, while also then trying to like appease the people in your social system, creates a lot of opportunities for deception. And like, when people aren't able to talk about what they need or what they perceive to need, that's sort of the foundation on which addiction and like more problematic addiction starts to become, more like invasive, right? Because if you're able to talk about what your needs are and you're able to be open about it, like that is a way out of more persistent addiction. It's when you perceive that the optimal solution to the situation is to lie to these people here, keep doing what you're doing, but like make sure everyone feels okay. Like that's, I think, that compartmentalization that really gets people into a lot of trouble.
That's so. Let me just go back a little. So expressing your needs, like having an open ability to express your needs, to others and to yourself?
Yeah, I think it's to be aware of them enough to where you're not having those same needs just get expressed. Because of course, a lot of this again is subconscious. It's not as if I'm choosing to lie to you so I can get the needs met. It's like you're just computing that, like, oh, to get my needs met, I have to say this to this person. The truth of that statement is irrelevant at that point. It's like, I need to say this so that will happen, and I need to, that will allow me to continue to use or whatever, right? So it's being willing to be more transparent about what your needs are or your perceived needs are. And that's, I think, where a lot of working with therapists can be really transformative, or AA and so on. Is like you're in a non-judgmental place where you can communicate your needs and you can be upfront about the fact that you've lied, and you can be in a situation where you're not responsible for the subjective evaluation of others. Like, you're not in a romantic relationship. You're not in, a child rearing relationship with someone. And so you feel freedom to speak your needs, but I think many people don't in their normal, natural environments.
it probably the needs, change over time. And the reason why therapy works and also the 12 steps work is because your needs change when your belief system starts changing, right? So like maybe, I struggled with different kinds of drugs at some point in my life, and I also struggled with pornography. So my needs were porn and certain drugs, but then I found 12 steps and I started finding spirituality. So now spirituality gave me a different belief system, and I started doing other things that triggered me also wanting to do meditation, that triggered me wanting to do this podcast. So now all of a sudden I'm doing all these other activities. Now all of a sudden my needs change.
Absolutely.
So now to the point where now I'm not even craving the other stuff. And it's not like I'm trying hard to not do the other stuff. It's just like my whole life's changed. So now my needs are different.
Yeah.
So I'm still wired in the same way. I'm trying to fulfill my needs, but I just have different needs now.
Right. I mean, I think that's a key insight, right? Which is, I think a lot of the reasons that those programs can work is that they do provide a new belief system in someone who's really struggling for a belief system. And they provide a lot of the other benefits, like the social benefits and just the feeling understood benefits that probably they weren't getting that much by just like using in their bedroom or whatever. So I think like just the notion of what are you using these things for in the first place, and then trying to displace those into things that are like natural human needs and creating a framework around it. Like I sort of believe like the details of the belief system in many cases can be arbitrary. Like obviously they have to be built on sort of like core archetypes and so on. But like I think that like exactly what you do, how many steps, et cetera, doesn't probably matter, right? It's the fact that you're helping someone kind of cohere around a new system of beliefs that takes that set of habits that for them has been the belief system, right? I mean, people organize their whole lives around achieving, getting high and like finding drugs, et cetera. So that, just like we were looking at before in terms of like habit chunking and so on, like their whole life has become now focused around that set of goals at the exclusion of many other goals. That's the thing that becomes really problematic about addiction, right? It's like, if you could just have your addiction and like your rest of your life works normally, like it wouldn't really be a huge problem. It's the fact that like the way that it works is it starts to take over more and more of your life. And so being able to get that set of habits back into a labile state by having this new belief system compete with that set of like well-worn habits to say like, well, sure, okay, you can keep getting high, but like, look at this other thing we can do that's really meaningful. And like you start to displace it. You start to get people sober, and you start to get these new sets of behaviors in there that are themselves habits. There's their routines, their habits of thought, if nothing else, right? So having those come in and displace, I think that's really the key, because just taking away people's drugs, right? To the Nancy Reagan, just say no, that clearly doesn't work. It's you have to find out why people are doing it and start to displace with things that are more productive habits that meet some of those same kind of core emotional and existential problems people have.
Yeah, like I remember when I went to rehab. I went to rehab because of Adderall. Above all things, I had already stopped a lot of other things that I did back when I was DJing and back in my club days. But Adderall really was a really hard thing for me to drop. So when I was in rehab, this gentleman came in to do a presentation on the 4th step. So he showed how to work the 4th step and this and that. And I was interested because before that, I just saw the 12 steps and they just looked like these religious nonsense sentences on a wall. And I was like, what the heck is this? It's nonsense. Once I realized that there was a work associated with it, then it seemed interesting to me. And the guy closed his session with something that stuck in my head and said, look, the 12 steps is nothing other than a program to become a better human being. And as a result of becoming a better human being, you just stop doing drugs.
Yes.
This doesn't mean like you're changing your belief system, right? You change your belief systems, the drugs are not interesting anymore.
Yeah.
Like for me, one of the biggest things that the 12 steps has given me is the idea of surrender and acceptance. And I think that I did drugs and drank alcohol because I could not accept the present moment the way that it was.
Okay.
It was either too stressful, too frustrating, or maybe too happy. I was so happy that I needed to drink, right? So there wasn't a natural acceptance of the present moment. I think that's one of the cool things about it also. That's just accepting things as they are, which not to be confused with complacency, right? Acceptance is just, hey, right now I accept. I may want to do things differently tomorrow, but we'll do that later. Now I accept things as they are. That has helped me a lot. And I think that's what we got rid of cravings.
Yes. That's fascinating. Yeah.
Yeah. I think, so yeah, what do you think about that idea of the surrender and the acceptance, like just from a, neuroscience perspective of what is going on there?
Yeah. I mean, I think I think William Burroughs said, control is controlled by the need to control. It's like many people feel that they need to control their lives, their experiences. They feel like they have a lot of agency over, what happens to them. And so they're always really worried about their behavior and how they're seen. And I think that can be paralyzing, right? Just to feel constantly like you need to rein in the controls to influence your future more, right? And I think that sense of agency is something that in psychiatry, we almost like help people erode that sense of agency in a way to just help them realize like how much of their behavior is being driven by things that are not in their control, and let conscious, unconscious, but just to realize like what behaviors you do, what dreams you have, like many things that you do are not something that you're controlling. Yes, we have choices, and there's certain things that we can choose to have that extra drink or not. But the reality is, like, I think accepting that you're this notion of self and this notion of like my decisions are unique to me and I get to like decide them myself. That's an illusion, and it's something that our culture helps us, brings up in us to create independence and create like somebody who can, have a job, etc. But like, I think that it can also really be problematic, and that like a lot of psychiatric, mental health conditions in general, like it's really helpful to take a step back from that and realize like all the forces that are influencing your behavior, and to relinquish that control, to relinquish that illusion of control. It's often a really important part of the recovery process. I think I've experienced a lot of people who come to me wanting to get better, but really wanting to control every part of the process. Like, what's the drug dose going to be? Like, I want to control my own taper. I want to control, like, if you're in that mindset of like if you're having a little bit of anxiety, it's like, oh, I can control that. I know where I can go for that. I can go to this drawer. I think that's a real problematic mindset, and of course, like if you're feeling bad, like you could take a walk. That also might make you feel better. But like, I think you want to really be cautious about that notion that like, if you feel bad, you can reach directly into a drawer and like find something that's going to make you feel differently. That kind of agency is elusive and illusory. And like, you don't want to go all the way and feel like, well, I have no influence then. But I do think you want to really erode that sense of agency somewhat and just, help people to see that there's like all sorts of behaviors you can do to generally make yourself feel better, but you don't want to believe that you have the secret knowledge that this one behavior is going to like be the key to your happiness.
Yeah. Yeah. The idea of like, so when it comes to like the 12 steps, like the idea of, like ideas like powerlessness, like I am, you finally, the idea like surrender to something you don't have control over.
Yep.
Seemingly. But there's a kind of a paradox in there too. It's like, well, you're powerless yet responsible moving forward. So there is that, that can be confusing.
Yeah,
I think some people,
it can be, but I think there's something special about that illusion of of control or illusion of like, this is my choice. And I think if you can question that and be like, oh no, I'm reaching for this drink, not because I want it, because of course, every other time I'd be like trying to convince myself like, no, I want it. I'm doing this because I have a right to this. I should, if you can acknowledge that like, no, I'm choosing this because my addict brain is telling me to do it, even though I know it's a bad idea. And like, maybe I'll do it anyway, but I'm doing it in a way that is not really my decision. Like and I'll probably feel bad tomorrow. And I think to have that realization, even if you choose to take the drink, the next day when you feel bad tomorrow, you'd be like, see, I knew I was going to feel bad. And then that voice in you maybe has a little less influence. But I do think it's like moving beyond the just so description of like, oh, well, no, I'm going to do this because I deserve it or whatever. And feeling like you have made a conscious choice. I think that's dangerous, right? I think it's like trying to push it back into that more label state about like, I don't know if this is such a good idea. I'm having one voice telling me to do it, one voice telling me not to do it. I think that's a better state to be in.
Is it, based on what you just said, is it safe to think about things this way, which is, got your brain, which is this machine, this, biochemical machine, right? That had these like intrinsic programs, very, very complex. But then there's your mind. So there's your brain and there's your mind, and there's almost like a separation. That's why you say, well, it's not like you're deciding to do it. It's your brain is making the decision for you, because there's almost like consciousness and then brain separation. Is that sort of a good way to think about it?
Well, yeah, because of course, like we could talk all day about like the fact that we all have brains in here, but like we don't actually experience that. So when you try to decide in a moment whether to do something, I personally find it's more helpful to think of that watcher, just that conceptual watcher, like watching over your behavior and just being like, I wonder what Justin's going to decide to do today, and like trying to sort of have the mindfulness to say like, normally in this situation, he would have another drink. I wonder if he will do it now, because then you can sort of say like, all right, well, what are like, maybe I choose not to have the drink that night. It's like, okay, it's interesting. Like, not like, hooray, like congratulations, but like, I wonder why, what circumstances brought about like him not choosing to have this drink. Maybe he got a little bit more sleep last night. Maybe he was good to himself today or whatever the case may be. Right. So it's that ability to like look a little bit outside of yourself and not judge yourself, to say like, oh, he took the drink today. Like, all right, maybe he got less sleep last night. Like, I don't, I'm not going to judge him on it, but like, so that's more of the mind. And in that diagram we were looking at, maybe it's that top of the part of the hierarchical decision making, who knows, right? But I think from a practical standpoint, as a mindful person, you want to be able to kind of be that watcher, and like not judge yourself on your decisions, but like add a little bit of time, just add a little bit of extra second or two to say like, what decision is he going to make? Because, again, there are good reasons to go in one reason or the other, one direction or the other. If you beat yourself up about the bad decision, it just makes that voice weaker. The voice that was like wanting to do, and I think you really want to avoid that. To say like, oh, I get, he chose the drink. I guess he's a drinker. Next time to go around, like that watcher is going to be like, oh, he's a drinker. He's going to drink again. So I think you have to be real wary of that and just like let the different deciders, let the different choices happen, and try to like watch yourself with some objectivity if whenever possible. It's always hard to do it at the moment, but
I'm glad you brought up that watcher. I love to bring it up in therapy with people, like the person that is kind of has this, kind of wise knowledge that you choose not to, like, you ignore it till you can't ignore it any longer.
Yeah.
And I think that's what people go through with change. It's like, especially big changes, like, they can't quite put words on it and reasons why they're just not taking those steps. But I think there's a very wise part of them that like knows how painful it's going to be.
Yeah.
Like they know how painful it's going to be.
Exactly. And that's where I think the judgment, that's why, we were talking earlier about like motivational interviewing and like that ability to meet people where they are and to talk to that watcher in them to say like, okay, so you're not ready to change today. Like, okay, that's the truth, but like you see yourself changing someday because you think like you don't want to be a grandparent and acting this way, whatever it is. But like you can talk to someone in a way that acknowledges both of those parts of them are always debating what to do next, and, I think that's, can be a really nice way to just connect with people and not always have that really judgy version of them, getting to control the situation.
And I feel like having that presence, that awareness, that mindfulness, right? In sort of training your mind to be there more, super helpful. Like it's helped me with, obviously with addiction, but also with other things, right? Like we were all dysfunctional in one way or another. So I caught myself getting upset at work-related matters. And, at some point you get so upset that your amygdala sort of takes over and now your executive function goes bye-bye, right?
Sure.
But now with more presence, with more awareness, I'm able to like see it all coming. Like, my boss will say something and I feel it first in my body and I feel like, it's nothing, but now I'm able to intercept it. And I was like, okay, wait a minute. Is this a big deal? No, it actually is not a big deal. It's a defense mechanism kicking in for some odd reason that I won't understand right now, but I can unpack it later.
Sure.
And I can up that.
Yeah. I think it's remarkable what adding that like second of additional thought can do, just to change what would have been an impulsive thing you said or did. You don't need a ton of time, but you need to like work to expand shit from being like a few milliseconds to like give yourself a little more time. Like I think, I don't know where we get this, but this notion that like we have to do things as quickly as possible. Our thoughts should be as quick as possible. That gets us into a lot of trouble, right? So if you can find ways to, in your life could just add a second here or there to some decisions you're making, that can be really powerful, right? Whether he's an adolescent making some bad decision or somebody who's, just like getting pissed off at his boss. Like you can add a second or two in there and make a slightly better decision. Cause that energy is bouncing around, right? It's like, got to get somewhere to go. And the question is, how long can you tolerate it for? Right? It's like, if you believe yourself to only be able to tolerate it for like half a second because it's just too much, well, then it's going to go out some hole that you didn't mean for it to go out. Right. And like, if you can tolerate a little longer, then you can kind of get it to go where, it gets marched up that chain of command more and you can kind of have it come out in a way or even just get processed in a way that is better for your overall benefit, right? It might, it does what it needs to do in the short term, but it also handles the longer term.
For sure. Yeah. It's a perfect storm for people who are addicted. Like the idea of like the recovery process is like excruciatingly slow. and you have to have faith that, through that process, you'll get to a place where you'll have, I always define it as like lower pleasure and higher pleasure. Like lower pleasure is like, things you become addicted to and things that run their course. Higher pleasures are things that you can't become addicted to. Like can't, like people say I'm a love addict. Well, you could be an attention addict, but you can't be, love is not something you become addicted to. That's like a higher pleasure of respect and integrity. Like those things, you have to have the faith that like through this process, like I will achieve, I will have these things that are more consistent, but yet a lot more powerful than alcohol.
Yeah. 100%. Yeah. And it's like, I don't know. For me, I liken these things back to just like nutrition, right? I mean, it's like, of course, every kid grows up loving like fries, milkshakes, and like, but at some point as you get older, not only does your, biology change, but like you learn that proteins and other things are going to make you, it's that higher pleasure. It's like, you can't, I guess you could overeat anything, but like, if you learn how to have a balanced diet, it's just going to make you feel better. If you learn how to use your body in a way, sleep and move around in a way that's like consistent with that more like balanced nutrition, like you will just feel better overall, and it's gonna last not just for the short term, but all the way out to many different time scales. And so, but learning that is of course really hard because you have to experience all of those time scales to know that that's even a thing. You have to have consequences. It's not like the brain knows about those consequences. It has to experience them through one way or another, right? You can learn it from someone else, but like most people need to learn it from experience. And so, you have to have your brain to the point where it can do that kind of time travel and be like, linking all the experiences together. But then you also have to have the experiences themselves. You have to, I think that's part of what hitting rock bottom is about, is like when the brain is having trouble learning way out here, you have to get to the point where it's causing problems like now, you're learning from the here and now. And then from there, your brain can start to shift again and then gradually learn to do the time travel again. But yeah.
And no, I agree. I think you got to experience pain to want to figure out ways to grow.
Yeah.
Because, when I get away from the pains, we're like, okay, I gotta do something different, right? I gotta change my game. Like somebody told me, I can't remember who, a couple of months ago, was like, yeah, pain is a really good system that you come with as a human being as a trigger for growth.
Right. Although it's also what Jeff was saying earlier. It's like oftentimes the addict is just seeking a way out of the pain. In the here and now, they're to the point when they're addicted, they don't even experience any pleasure out of it anymore. Not even the lower pleasure at that point. It's just like avoid pain. And so that it can be a double-edged sword, right? Because that impulse to avoid the pain is exactly the thing that's reinforcing that habit. It's being able to balance that short-term pain with long-term pleasure. To avoid it now means in a month or maybe a year, feel better. Like that's a very hard thing to convince yourself to do in the moment, right? But
yeah, and I think that goes back to belief systems. Like I caught myself, up to like a couple of years ago, having this false belief that, happiness was achieved when you get to this point in life where you don't have any major problems. But I mean, you don't stop having major problems. That's just life, right? And I was under this very incorrect assumption. Maybe I was just very lucky that for many, many years, I didn't have any major problems. And then they came, and then real problems came. And I was like, oh shit, like now I really gotta do something different. And as I've gone into a new journey in life, I've now learned that, hey, major problems will come unexpectedly, even if you did everything absolutely perfectly, right? And it's just part of life. And that's where the acceptance kind of comes in.
Yeah, 100%. Yeah, I mean, I think, like you say, we go through stages of life. Our problems change. When we're little, we're trying to find mom. When we have to shift to creating our own nest, we do that. But then as we get older, there are going to be new problems, and life is not about avoiding problems. It's about being resilient to these problems and being able to tackle them from a point of being centered and being able to use as much of that whole brain that you have, that you evolved and you've developed over your life to tackle the next set of problems. So, what you don't want to do is get yourself in situations where you're effectively shutting off parts of your brain because you don't want to think about it or acknowledge that part of yourself anymore, because then a new problem will come along where that part is needed. So you want to be able a point where you can integrate as much of your experience as you can. The good parts, the bad parts, know that it's normative to have all of that. There's nothing that you need to be ashamed of. It's all about, you've moved through this, complex risk landscape from the moment you were born and really before that even up to this moment. And like all of that experience can be used to hit the next, tackle the next set of problems and like being awake to that and like, not necessarily dwelling in that past, but like being able to be open to whatever the present brings you. I think that's the key, right? And that's where if you're easily thrown off of that center because something unexpected happens and you want to then, your impulse is to go back to that thing that you remember being helpful in the past, that drug or whatever it is. That one isolated memory, that one behavior you did before to get high or to kind of like numb up, whatever, is that really the thing that's going to be helpful in this moment to tackle this challenge? Like, it's probably not, like
Make it worse.
It could make it worse, right? So it's like, again, it's more about drawing on the totality of your experience. Like, there may be situations where having that drink is perfectly okay. Like, it is the next, but like, when that serious thing happens, is that truly the thing that's the response? Like, if you're honest with yourself, like most cases, it's probably not, so.
Yeah, makes sense. Like Buddhist peeps talk about this in terms of the first arrow and the second arrow. They say that you're always going to get the first arrow. Like life is just going to always throw first arrows at you of different sizes. So there's this little first arrow, so it's a big first arrow. And then it's really up to us on whether we'll throw the second arrow at ourselves or not. And most often when the first arrow comes in, either with thoughts or actions, we throw a second arrow at ourselves, right? Even like when we make a mistake and something bad happens out of that mistake, well, that's first arrow. But then sometimes we interpret it as like, oh, I'm a failure. I really suck. I shouldn't have made that mistake. So that's the second arrow and you're rubbing it in, right? It's like you get the second arrow and you're like, I get in there.
Yeah.
And the trick is to, first arrow comes in, just be resilient, take it in. It's like, all right, what am I going to do with this? Let's move through this.
Right. Absolutely. And of course, like that's that big place where trauma and other situations like that can make it really hard to avoid that second arrow because it's so distracting and it's so, it pulls up all that other experience and suddenly you can't respond with the totality of the experience anymore. You're really biased by some of these other prior experiences, either in an avoidant way or in a way that you're drawn towards certain experiences, certain behaviors. But I think that's the reality, right? And it's just also acknowledge like, I have a tendency to point that second arrow at myself or whatever, and just to add that additional few seconds to say like, I have a tendency, but I'm not going to do it. Like to acknowledge that like having dark, painful and unproductive thoughts is a totally different thing than acting those thoughts out. And I think it could be really productive to embrace your second, like the alternative model, the alternative behavior, just to be like, right at that moment, I really wanted to watch some porn, right? Or I really wanted to have that cigarette, or I really wanted to do that line or whatever. And just embrace it as like, oh, that was a thing that I really wanted to do in that moment. But I chose not to do it. When I was trying to quit smoking, I convinced myself that I was addicted to secondhand smoke because I was like, that was my main trigger. And I just was like, every time I smell that secondhand smoke, I'm like, oh my God, that's the best thing ever. I want a cigarette. But I kind of just like convinced myself that what I really loved was secondhand smoke. And I just loved to just like breathe it in and like, that was the best. And so I just changed the behavior I did, in a way that was like, it's like a little bit of like mental gymnastics, but I think that kind of thing can be really helpful just as you're working yourself out of those like dense habits to something that's like slightly the sway of it. And then you can kind of walk out of it in a way, it doesn't work for everything, but just to sort of acknowledge, I have two paths. I'm taking this one today. I could have taken that, and just to embrace it. Like, don't judge yourself on it, just to say like, yeah, that was a thing. That's something I might have done today.
Yeah, makes sense. It's kind of going back to something you said earlier, that we can convince ourselves of anything, right? Almost, right? We were talking about it in the context of deception, but I think that it could be a great tool, right? I mean, really, isn't it that like our memories, the way that we understand our memories, it's only like the percentage that is actually true is pretty small compared to like what the thing actually was. And the rest of it is just the story that we told ourselves from that memory. So if that's the case, it means that we can synthesize our paths in any way we want.
It's a magical ability that can get us into trouble, but also can get us out of trouble, right? Because if you tell yourself certain stories, if you change the narrative, I mean, a lot of what we do in psychiatry is we help, psychology is we help people with dysfunctional narratives, right? We help them take a maladaptive narrative that they have for themselves and just like reframe it, right? We change it and then we help them to believe the new narrative, and it can't be, like with all narratives, it can't be too different from the core narrative or they're not going to be able to make that jump. But if you can make a slight change of the narrative, they can make the jump, and then they could just, I really do believe like, you have to tell yourself that new narrative. If you keep going back and telling yourself the old narrative, even if just saying it out loud can have power to reinforce that older narrative. So you gradually get people to talk in the way of the new narrative, and they start to believe it, and it's like, it's that kind of cycles of, I call it like the play within the play. It's like you come up with something that is obviously manufactured, but like you have to believe it for at least some period of time before you're truly skeptical of it again. That's the way to move yourself forward. You just have to come up with some narrative, believe it wholeheartedly, act it out. And then like, it's okay if you become skeptical of it again. That's the natural cycle. But like you use that to move yourself between states of being stuck.
Interesting. Yeah. I've used that, but I do know what I was actually using. I'm glad you explained it to me because it does work. It does work, changing, reframing things and how it, how that like moves people. You give them sit in that space for a second, can build over time and it can become your narrative.
Right. You tell yourself like, well, I'm not drinking because I don't like the way I feel in the morning. And that's my most important priority right now is how I feel in the morning. And so I'm not going to drink anymore, even though I like to drink because I feel bad in the morning. Like, obviously that's one of many factors. But if you just tell yourself that, like, I'm going to be on a kick to not feel bad in the morning anymore. So I've stopped drinking this month to feel better in the morning. Like little narratives like that. If you can convince yourself that they are true, like again, going back to cigarette smoke, but like I convinced myself that I wasn't going to smoke in my car anymore because I had bought a new car. And so I just was like, I really don't want my car to smell bad. So I'm never going to smoke in my car. And that was the thing I kept rehearsing to myself. And so like gradually like that led me to not smoke in a lot of context, but it was like that starting from the car thing. And like people were like, well, why did you quit smoking? It's like, well, I got a new car. Like that was just the story I would tell myself. And so it's just embracing those little stories and having that kind of like, that's how I conclude of where I got from point A to point B. Again, it's partly you just made up a story, but it's believing that story and sticking with it.
Yeah, I got I worked in recovery, I worked in rehabs and all different areas of it. And there was a shift, obviously from 30 days. And I learned that 30 days was just an insurance cutoff for the most part. To people saying like 90 days was, kind of the premium. And like people being sober for 90 days. And one thing that I know is like habits, they say habits are built in 90 days or different ways of thinking. But I think also in recovery, if your Steve is external motivation, like other people, like you're doing this because I don't want my wife to yell at me tomorrow.
Right.
Like I don't want to wake up or yell at me. I don't want to wake up and I can't spend, $1,000 a week, because, these little things, that motivate us. But we say like, outside motivation will get you about, 60, 90 days in, but you need internal motivation to get beyond that.
Right.
You need a better why you're doing this before, or you're just, once all the, like you said, you continue to work with these smaller motivations and these smaller narratives until you get to a certain point where you got to grab onto something that's like much more like significant, I think.
It's tricky, right? Because I guess in my case with the car, it's like at 90 days, my car still smelled semi-new, right? So that was a life hack I did that it wasn't going to change in 60, 90 days or even a year. Like a year into buying this new car, I still wanted to not smell like cigarettes. So that was one of my ways to like force myself to, I was allowed to smoke anywhere else I wanted, but I used that to just sort of, but I do think, it's this whole idea of like internal motivation. Yeah. I mean, obviously you want to get to a point where, you've integrated into your new view of yourself and you kind of like don't see this as part of you anymore and so on. I think ultimately that is the goal of like trying to change something from an appetitive stimulus to an aversive one. Like, but with any of these tricks, right? I think some of it is that you're trying to harness the brain's ability to switch something's valence from positive to negative or negative to positive. And so you use these life hacks to go through that process to where now the cigarette doesn't smell good to you anymore. Even the secondhand smoke doesn't smell good to you anymore. You have no interest in putting it in your mouth anymore because it starts to be aversive. That's the point where I would say it's like an internal motivation now. It's like you've now taken that brain mechanism and flipped it on its head and said, okay, I'm going to put that cigarette smoke into a more labile state by playing this game with myself and telling myself this narrative. But in doing so, I'm actually, every time I think about cigarettes, coding it as negative so that eventually when someone offers me that cigarette, I'm not coming up with narratives anymore. I just think it's gross, so it's like that. It's because I've now hard coded it as an aversive stimulus again. So I do think you have some leeway. If you can't just avoid it, right? Because if avoiding it, there's no learning. You need to actually learn to code it as an aversive stimulus again, right? And I think that's the thing that like, it can be dangerous if you just avoid the thing, if you just avoid bars and you don't just go anywhere near alcohol. If you really want to avoid it, it's important. If you really want to code it as aversive, it's important to experience it in a way that you can experience it as a negative thing. But again, that can be tricky because you don't want to expose yourself to it and then try it and then change your mind again. But if you could kind of life hack it so that every time you think of it, it's associated with a negative association, then you can gradually do that, I guess. But
so I could imagine, from this conversation, like there may be listeners out there that are listening to this whole thing, and then they're like, "Well, you guys just don't get it because you're making it sound like I just got to change my narrative. You're making it sound like I just got to change my associations. You're making it sound like with this mindful awareness, everything will be more monitored and better. But you guys don't get it. Like I have a big problem. I have a big heroin problem. I just can't fucking stop doing this." So
yeah,
what kind of advice would you give to somebody like that?
Right. I mean, well, I guess it depends on that person is like, you said I have a big problem. So I'm assuming that person sees it as a problem. So I would start with that person around like, is it a problem? Like, do you think this, like, what makes you think is the problem? I mean, obviously everyone thinks drugs are bad and everything, but like, for the person who's doing a lot of heroin and recognizes that it's a problem, I would honestly want to start there and just to unwind, like, in what way has this become a problem? Because I again have to assume that they started doing it because they were getting something out of it. Maybe they're at a point when they're not getting high anymore. They're just experiencing the pain part of it. Right. So at that point, if someone was to come to me at that point and be like, I could stop this problem, like there's all sorts of things one can do. You can go to a treatment center and like get away from the drugs for a while. You can switch over to, Suboxone, et cetera. And like, there's a lot of sorts of great stories about people who managed to do that. Right. But I think like the reality is if you're still doing heroin and you're enjoying it and you're like getting something out of it, or you're like feeling like you can't stop doing it, then like it's important to recognize that you don't have agency at that point, that there's a certain significant component of your behavior which is not really your choice, like however it started, and to just ask yourself, like, is that really the way you want to behave? Like, do you really want your behaviors driven by this impulse that is like not really you? And if you're not totally comfortable with that, then I think it's a good idea to include someone else in this journey with you, someone else who you can trust to take some of that agency, and that you can trust to sort of make some decisions on your behalf, whether that's somebody like a psychiatrist or a friend or someone else in recovery. But like, I think that's a dark point of addiction where you're just like compulsively using and not seeing much benefit from it. So I think that's a place where it's not about mindfulness, but it is about like moving back from that agency to the point where you can kind of start allowing someone else in a little bit and helping make some decisions. But, it's easier said than done, obviously.
Fair enough. But it's more like a simple two-part mini process that somebody like that should go through. One is just accept that they can't control it. They have no agency. Nothing they do will make it stop, right? Just accepting that. And two, go get help.
Yeah.
Right.
Because, you're probably, someone like that is probably using it in all kinds of situations. And the problem is like, for better or worse, like some of those situations might be more appropriate than others in the sense that like, sometimes they might be doing it when their kid's about to come over and they like still can't stop themselves from just getting high, right? As opposed to like they're by themselves or they're with a friend and they're just getting high to socialize. Like there still are levels, right? And so if you're finding yourself where you can't control any of those contacts, then that's a problem, right? But like, you shouldn't just equate it to be like, oh, I'm a junkie, I'm just going to be a bad person in general. Like, you should be able to unwind it and be like, all right, let's start with the ones that are the problematic ones, the ones where like I don't even want to get high and I find myself getting high, like where there's a chance of these two sides of yourself having a vote, right? In that kind of hierarchy, because there are real pros and cons there. There are other situations where like getting high might be okay. Like it's not the worst thing to do to get high, in that situation. They're not equivalent, right? So I think, just being honest with yourself, not too harsh on yourself, and like getting help to make those decisions with somebody else on board.
Do you know any? I know that one thing that gets in the way, like, or people interpret it as a lack of agency, is when people take medications to help with addiction. Like, people can see it like, well, you're not doing the tough stuff without the medications. You got to go through this without this stuff to like really get the full effect of it,
Yeah.
Especially, yeah. And so I think a lot of people, everything from antidepressants to like, Vivitrol, Suboxone, and abuse. There's something about that people shy away from it because they feel like they need to go through it like kind of raw.
Right. Yeah. So, I mean, I guess the big difference is, well, to be like concrete about it, like there's a big difference between scheduled medications and as needed medications, right? So if I'm on Xanax and I reach for a Xanax every time I get slightly anxious versus a bottle, like that isn't all that different. And so feeling like you have the agency to decide in the moment which substance you're going to reach for, which behavior you're going to reach for, that's the problem, right? It's not having something on board in a more continuous way that's just tipping the balance in favor of you having a more like access to all those parts of your brain, like all of that totality of experience, right? So I think like someone who uses antidepressant, it's not going to make them feel better. I mean, we all know like they don't work that way. Like you don't take an antidepressant and feel like better the next day. So it's, in a way, you're giving up the agency by saying, I'm letting this other drug take over my system. I'm not going to have any control about when I take it. I'm going to take it every single day, whether I feel good or bad. I think it's that type of letting up your agency is a good thing. Like I think taking a scheduled medication because someone else said to do it, and doing it regardless of how you feel, whether you have a virus that day or you didn't get sleep that day or whatever, that is a productive thing to do. Taking medication, Vivitrol or Antabuse, I mean, same thing, I guess, right? You're taking something that's just in your system now and it's guarding against something that could happen. But in a way, you're letting up that agency. You're letting someone else decide to prescribe it to you. That's where the magic is. It's not, in my view, like taking a drug or not taking a drug. It's the fact that you're letting someone else set the treatment plan for you, and you're going to adhere to it because someone else decided that it's good for you, not because you are the one like picking the exact dose and like all of that stuff.
Yeah, it's like, a lot of times people just have different views of that in working with them, but also like it's more predominant in like a 12-step setting,
Sure.
The thing that comes between you and the next drink is, higher power stuff and like your willingness to kind of abstain, and that should be like a pure,
Right.
I know that be more open-minded to like the idea of like different psychopharmacology.
Like to me, that 12-step program is the same as agreeing to take the antidepressant. You're like giving your powerlessness up and saying like, whatever you think I should do, I'm going to do that. And so agreeing to do the 12 steps in a way that is humble and is going to go by what the belief system in that book says, as opposed to what I want to impose on that. Of course, we all come to it with our own experiences. The point being like, I don't know anymore. I'm relinquishing my control to you, whether that's the psychiatrist prescribing the antidepressant or this 12-step program telling you how you want to like, to me, those are the same in the sense of like, we were talking earlier about like the details of that 12-step program, maybe not that important. It's the fact that you're willing to let this other belief system come in and take over your kind of like special belief system that you've developed, where like doing this drug or doing that behavior is the thing that's going to get you well. So yeah.
All right. Well, I think we're coming here to an end. We've been hanging out for an hour and a half, which is awesome.
Yeah.
Yeah.
I got one more question.
Yeah.
You guys developing any like kind of neurotechnology biomarker that will gauge someone's willingness? I'd like to give away.
Yeah. So there's all kinds of interesting new neurotechnologies out there. So, I mean, there's, one of the ones, I don't know about the willingness, but I guess, stimulating prefrontal cortex seems to be helpful in reducing people's impulsivity. And so like, there's all sorts of technologies now with like direct current stimulation and probably TMS, transcranial magnetic stimulation, light therapies, things like this that are all designed to stimulate the frontal cortex and reduce impulsivity. Do they work? I don't know if they work. I think what's clear is like anything you can do to bring those systems online does seem to help the brain do that time travel stuff. So really, I don't think of it as the prefrontal cortex suppressing the amygdala as much as I think of the prefrontal cortex as providing context to the amygdala. And context usually means not just like different context in the here and now, but like context over time scales. And so like anything you can do to tip the balance in favor of systems that are designed for like longer term thinking tend to help people make better, we would call them better decisions, right? It's like decisions that incorporate your future self. I think we will continue to see, we were talking earlier about how do you get yourself into your optimal. It's that same idea. It's like when you're at your optimal, you're looking across all those time scales, and you're weighting them appropriately. Because of course there are going to be times when a near-term time scale is more important than a long-term time scale. But it's that ability to do the time travel and to weigh them in a way that's balanced. And that way, like, if the right decision is to have this extra drink tonight because you're with some friends, okay. But if that right decision is to not have that extra drink because you're going to feel bad, like that's what those higher order systems are there for. So anything we can do, whether it's brain stimulation or cognitive therapies and things, those are the things that are going to be most helpful in the long run.
Okay. I just got to ask about, what are your thoughts about hallucinogens, ketamine?
Yeah. So I was just thinking, psilocybin, hallucinogens, probably do, really activate those systems in a ways that, I think probably one of the reasons they have such an antidepressant effect and that they are things that teenagers, like the risk-taking behaviors, like find their way to these kinds of compounds is that they really activate those longer-term thinking circuits in your brain. And so you have access to all kinds of information that you hadn't considered before. So, I think done in the proper context, like they could be transformative for people, especially if they're stuck in that kind of near-term thinking. It forces them out of that to see how their behavior is going to affect future versions of themselves.
Yeah. It's tricky working with addicts.
It is, especially when you have drugs that have addictive potential and antidepressant potential, depending on how they're used in which context and things. So,
and they could take ketamine home with them, so.
Absolutely. It's getting more and more complicated.
Yeah. Oh, thanks so much.
Yeah, awesome.
I feel one natural way to sort of accomplish the same thing that psychedelics give you, and instead for somebody that's done psychedelics as well, it's just meditation. Like, I remember one time I did a whole ayahuasca, ceremony, like a thing, and it was pretty transformative. Let me rephrase that. It was very impactful, but there was a knowledge on how to integrate it. So for me, so I had some insights through it, but then what's been very transformative has been meditation. I feel like I got some of the same things that I got from the ayahuasca ceremony, but like literally on a day-to-day basis.
Yeah. Well, that's like the amazing thing is I think, you have to remind yourself that drugs, exogenous substances do not cause your brain to experience these things. Your brain is already capable of experiencing those things. This substance activates a circuit that's already in your brain. Right. So, realizing that, yes, you hijacked it, you were able to stimulate it without having to prepare, but again, there are consequences there. Whereas you can learn practices that stimulate those same brain areas and create those same experiences. And like interesting part of life is to learn ways to do those same behavior or achieve those same states of mystical experience, whatever it may be, but without the downsides and without the shortcuts. It could of course be appealing to take shortcuts, but as you said, you're not going to be able to do that every single day without consequences. Whereas if you can do that with other things like meditation, you may be able to achieve that. So I think it's a really good point.
100%. Well, we'll have to stop because I can keep going for another 2 hours easily. But one more question though.
Yeah.
Your music instruments in the back.
Yeah.
Let's talk about those.
Okay.
5
Yeah.
minutes. What do you got going on there?
Oh, well, yeah. So I have, there's a guitar, like just an old, acoustic guitar, nothing fancy. I have my, Nord keyboard here. And then there's a sitar here, which you kind of make out over my shoulder. And then, just a bass I got on Amazon for like not too much money. And then, there's my Telecaster over here. Yeah, I'm trying to and I guess here I'll go a little bit further. There's a couple of, there's like a mandolin here, and then this is I was told this was a domra, but also somebody from Eastern Europe told me it wasn't a domra, but so I don't actually know what it officially is. But I got all kinds of instruments here in my home office.
That's amazing. So you jam every now and then.
Absolutely, yeah.
Awesome.
Good space for that.
That's a good way to let creative energy out.
Absolutely. It's, I'll admit, like, there's definitely some drinks or other things that accompany the music making, but I see that as an appropriate use of exogenous substances.
That's fair. Right on. So Justin, this has been amazing. It was really fun. It was very educational as well, very informative.
Awesome.
So thank you for making the time and hanging out with us.
Yeah, no, I learned a lot as well. So I really appreciate the opportunity, guys.
I appreciate it. Yeah. Amazing. Yeah, I've got to weed through my notes. Yeah.
All right, guys.
Well,
Have a good night.
All right. Take care.
Okay. Well, yeah.
Bye, guys.